Eye floaters are a common visual phenomenon that most people will experience at some point in their lives. These floating spots, specks, or thread-like structures can appear in various shapes and sizes. Some people see small dots, while others might notice thread-like strands or even ring-shaped floaters. They tend to move as your eyes move, often darting away when you try to look at them directly. Floaters are most noticeable when looking at a plain, bright background like a blue sky or a white wall. Although eye floaters are generally harmless, they can sometimes be a sign of a more serious underlying condition that requires medical attention. Eye floaters occur in the vitreous humor, which is a clear gel-like substance that fills the space between the lens and the retina in the back of the eye. As we age, the vitreous humor can become more liquid and shrink, causing tiny fibers within it to clump together and cast shadows on the retina. Eye floaters are quite common, especially among older adults. It is estimated that about 7 out of 10 people over the age of 50 experience floaters to some extent. While floaters are generally more prevalent in older individuals due to the natural aging process of the vitreous humor, younger people can also experience them, particularly if they are nearsighted, have had eye trauma, or have undergone eye surgery. Causes of eye floaters. The causes of eye floaters are varied and can range from harmless causes to more serious conditions. The most common cause of eye floaters is age-related changes in the vitreous. As we get older, the vitreous begins to liquefy and shrink, causing it to pull away from the retina. This natural process can lead to the formation of clumps or strands in the vitreous, which cast shadows on the retina and appear as floaters. In addition to age-related changes, other factors can cause or contribute to the development of floaters. Eye trauma is one such factor. A blow to the eye can cause bleeding in the vitreous humor, leading to the sudden appearance of floaters. Inflammatory conditions like uveitis, which is inflammation of the uvea or the middle layer of the eye, can introduce inflammatory cells and debris into the vitreous humor, resulting in floaters. Retinal tears or detachments are more serious causes of floaters, where a tear or separation of the retina from the underlying tissue can cause the release of cells into the vitreous humor, creating floaters. This condition often requires prompt medical attention to prevent vision loss. Diabetic retinopathy, which is a complication of diabetes that affects the blood vessels in the retina, can also cause floaters. When blood vessels leak or bleed into the vitreous humor, floaters can appear. Similarly, eye surgeries such as cataract removal can sometimes lead to changes in the vitreous humor that result in floaters. In very rare cases, tumors or other growths within the eye can cause floaters by releasing cells or debris into the vitreous humor. Symptoms of eye floaters. The symptoms of eye floaters are usually quite distinct. Most people describe seeing small, dark, shadowy shapes that drift through their field of vision. These shapes can vary widely. Some people see spots, others see thread-like strands, and some describe seeing cobweb-like formations or rings. The experience of seeing floaters can feel strange and even unsettling at first. They often seem to dart away when you try to look at them directly, and they tend to move as your eyes move. Many people find floaters most noticeable when looking at a bright, uniform background like a clear sky or a white wall. In most cases, floaters are more of an annoyance than a cause for concern. However, if you experience a sudden increase in the number of floaters, especially if accompanied by flashes of light or loss of peripheral vision, this could indicate a more serious problem like retinal detachment and requires immediate medical attention. Some people also report a subjective feeling of a curtain or veil coming down over their vision, which can be a sign of retinal detachment. Others might experience a persistent floater that seems to be in the center of their vision, affecting their ability to read or drive. The way floaters feel can vary from person to person. Some people barely notice them, while others find them significantly disruptive to their daily activities. They don't cause physical pain, but they can cause eye strain or headaches if you constantly try to focus on them. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of eye floaters. Diagnosing eye floaters typically begins with a comprehensive eye exam. An eye doctor will ask about your symptoms and medical history, then conduct a series of tests to examine your eyes. One of the main tests used is a dilated eye exam. In this procedure, the doctor puts drops in your eyes to widen your pupils, allowing them to see the back of your eye more clearly. They'll use special instruments to examine your vitreous and retina, looking for any tears or detachment. The doctor may use a slit lamp, which is a microscope with a bright light, to examine the front and back of your eye in detail. They might also use an ophthalmoscope, a handheld device that allows them to see the back of your eye. Another common diagnostic tool is optical coherence tomography. This non-invasive imaging test provides cross-sectional images of the retina, allowing the doctor to see its layers in detail. This can help identify any areas where the vitreous might be pulling on the retina. In some cases, especially if the floaters are obscuring the view of the retina, the doctor might use ultrasound imaging to get a clearer picture of what's happening inside the eye. This is particularly useful if there's suspicion of a retinal tear or detachment. Treatment for eye floaters. The treatment for eye floaters largely depends on their cause and severity. In many cases, especially with age-related floaters, no treatment is necessary. Over time, your brain may learn to ignore the floaters, making them less noticeable. Many people find that the floaters become less bothersome as they adjust to them. For those with more bothersome floaters, there are several treatment options available. One is a surgical procedure called a vitrectomy. In this operation, the vitreous gel is removed from the eye and replaced with a salt solution. While this can be effective at eliminating floaters, it's a major surgery that carries risks such as retinal tears, retinal detachment, and cataract formation. Due to these risks, vitrectomy is typically only recommended in severe cases, where floaters significantly impact vision and quality of life. A newer, less invasive treatment is laser therapy, also known as laser vitreolysis. In this procedure, a special laser is used to break up the floaters, making them less noticeable. The laser targets the floaters, breaking them into smaller pieces that are less visible or that can be more easily absorbed by the eye. However, this treatment is still somewhat controversial, and its long-term safety and efficacy are still being studied. It's not suitable for all types of floaters, and is typically only used for larger, more defined floaters. For floaters caused by inflammation, treatment may involve addressing the underlying cause. This could include anti-inflammatory medications or other treatments, depending on the specific condition. For example, if the floaters are caused by uveitis, corticosteroid eye drops or oral medications might be prescribed to reduce inflammation. If the floaters are caused by a torn retina, treatment is crucial to prevent retinal detachment. This might involve laser surgery or a freeze treatment called cryopexy to seal the tear. These procedures are typically done on an outpatient basis and can help prevent more serious complications. In cases of retinal detachment, immediate surgery is necessary to reattach the retina and prevent vision loss. For those living with eye floaters, there are some strategies that can help manage the condition. Some people find that wearing sunglasses in bright environments can help reduce the visibility of floaters. Others find relief by moving their eyes up and down or left to right, which can shift the floaters out of the field of vision temporarily. Maintaining good eye health is also important. This includes protecting your eyes from UV light, eating a balanced diet rich in vitamins A, C, and E, and getting regular eye checkups. Staying hydrated can also help, as it promotes good eye health and may help reduce the appearance of floaters. Now, we want to hear from you. Do you or someone you know have eye floaters? What do you think is the cause of it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.